Hello and welcome everybody. My name is Nick Wilson and I'll be helping to facilitate our webinar today focused on driving IT operational excellence to support hospital performance, turning IT into an asset. Before we get started, I'd like to cover a few housekeeping items. First, the session is being recorded and the download link to the recording will be shared afterwards via email. Second, we will have live Q&A with our presenters. To ask a question, please use the chat box feature on your GoToWebinar control panel, usually to the right of your screen. For any questions we can't get to in our live session, we'll be sure to follow up with you afterwards. Now I'd like to turn the webinar over to Dr. Mike Breger to cover the agenda, to facilitate some introductions, and to delve into the content. Mike?
Thanks, Nick. Appreciate it, and welcome everybody. It's good to have you all on board with us today. My name is Mike Breger. I lead the Life Sciences and Healthcare Industries Group over at CEI. Today with me is Brett Scott. Brett, are you there and care to say hello?
Yes, hello. Welcome to everyone. This is Brett Scott. I lead up our IT operational excellence practice over here at CEI. And I've got 25 plus years really of IT experience. 15 of those years have been spent over at Accenture as a partner. And I help with a lot of different IT leaders in a variety of industries, including the healthcare industry, to improve their operations and drive cost savings and efficiencies. So welcome everyone.
Thanks, Brett. So over the next half an hour, 45 minutes or so, we're going to be tackling the issue of driving IT operational excellence in support of hospital performance. Sort of a subtitle to all of this, we're calling it IT as an asset. And the reason we're doing this is so often IT is looked at sort of the cost of doing business. It is something that is there because it has to be there. Data is digitized and collected only because it has to be done in this fashion. What we want to talk about is starting to really look at your information technology programs as something that you ought to see as a business asset, something to help you in the operation of your healthcare centers, your small, medium-sized, and even large-sized hospitals, and ultimately, if done properly, something that will absolutely benefit the healthcare of patients in the environment. Geez, we should have moved the slide up a little earlier because there we are. There's the talking heads on this presentation today, Mike and Brett. So let's jump right into this. As you see on the top of the screen now, it talks about a rapidly changing marketplace, rapidly changing industry dynamics. And you find this in every industry. In fact, the whole digital revolution has really created a rampant number of challenges, again, in every industry. But those challenges themselves are actually creating opportunities and opportunities for improvement in terms of patient care and business operations in hospitals and healthcare centers. We deal with issues of the so-called data explosion, as you see on the left. The digital innovation, in fact, has led to this data explosion. And the biggest challenge isn't so much that more and more data is being made available to us every single day. Biggest challenge is what to do with all the data, how to quickly analyze it, how to quickly categorize it, how to quickly taxonomize it, and more importantly, how to quickly structure this data so that it becomes information allowing us to use it in a knowledgeable fashion. And in our industry, in healthcare, in life sciences industry, like several other industries, these industries are fraught with regulations. So yes, we need to do the right things by our patients and by our consumers and by the customers, but we also need to do it in a format that's compliant with regulations on a local basis, a statewide basis, and even a global basis. There's variability in funding, how money comes into our organizations, how we spend the money and how we document the funds that are available and made available to us. Now, all along the way, transformation has to happen. Transformation can either happen strategically because we want it to, or it happens because we've thrown extra layers into a particular process or a particular organization where the transformation just sort of happens by itself. It's a chaotic transformation in that case, as opposed to something that's strategic and something that we can leverage to actually create value out of. But transformation is always happening. This is ever evolving, and we need to tap into that evolution to make it benefit the business and the hospital organization itself. And there's emerging competition. Now, emerging competition doesn't necessarily mean there's more and more competitors each day. It means there's an evolution of competition. The healthcare provider isn't merely the doctor in the white coat that you see in the medical office on a regular basis, nor is the healthcare supplier the hospital, the healthcare organization that we've known in the past. The internet has changed everything, and it changed everything a dozen years ago, perhaps before that, and it continues to change and change. So along those lines, one of the biggest issues that continues to face our industry are all the different types of systems that are out there, all the different bits of data that are out there, and in fact, interoperability of all these systems. The systems are just not speaking to each other. And in order to have data, just a bunch of numbers, become contextual, become information where we can do something about it, you need to have the systems contact each other, connect with each other, talk to each other, and make decisions together. Interoperability has been, is currently, and for the foreseeable future will be one of the largest challenges that will need to be faced as we continue to digitize the healthcare industry space. And finally, along the line of regulations are the issues of patient confidentiality and the whole management of regulations about being HIPAA compliant. So every department in a hospital or in a healthcare organization works together to serve a patient. And there's all of this change that's going on. But as you see here, we need to start to think of IT, and not just the technology itself, but the IT groups, the groups that are managing the technology, using the technology, and making recommendations as being a so-called force multiplier. All these little icons, all these little boxes are things that the IT individual, the IT practitioner needs to be concerned about in the organization. But is one person equally concerned about every little box that you see here? Or is one person more concerned about one thing versus the other? Regardless, you need to have multiple people in the IT organization thinking about themselves as this force multiplier, as this change agent, and start to look at how they can improve the overall business and the overall potential health of the patients by leveraging best of breed areas within each of these spots that you see here. So if you look or talk to to the technology leader in a particular organization, in a particular hospital, in a particular healthcare center, you will find, as we have found through various interviews, discussions, and just working with these individuals for many, many years, many of the issues are the same. These 6 bulleted items on the left come up all the time. EHR interoperability, as we spoke of earlier. Being able to maintain legacy technology. We can't buy the newest shiny toy every day, every other day. I mean, we have to use technology that's old, in some cases is ancient. And how do we maintain this technology when everything else is changing at such a rapid pace? Adoption of new technology by physicians, nurses, and clinical staff. Probably 3/4 of the hospital and healthcare organizations that we've talked to mentioned this as a significant issue because they tell us the physicians, the nurses, the clinical staff don't want to use the new technology that's put in front of them. And that's the new technology from an IT perspective, from a pure information technology perspective. They will use it and they will adopt to it only if they are forced to do so, which is bullet number 4. These two bullets together basically continually provide a story where training becomes something that they are doing because they have to do it, as opposed to doing the training because they want to do it, which means they may not be as adequately trained in utilizing all the functions and features of a particular bit of technology than you would like them to be. As you bring in more and more technologies, you use more and more software, you are talking about assets within the organization. And how do you track these assets, excuse me? How do you find out what you have in place, and how do you manage it? How do you make sure that it's kept online? How do you make sure that it's kept up to date? How do you make sure that it's kept active and safe and secure and compliant with the regulations that are out there? And finally, the workflow of patient records. If intake is done by one part of the organization, what does it take process-wise to move this bit of information from one area, from one function, to another area, to another area? How do you manage the workflow? This is actually an issue that's plagued the manufacturing sector for many, many, many years. ERP systems such as SAP, the old J.D. Edwards systems, currently Microsoft Dynamics tools, have really been able to mollify the situation and make workflow a lot easier in manufacturing records that have to move within a manufacturing organization. But we're dealing with something very different in a healthcare organization, and the workflow of patient records becomes critical. Overall, there's a big challenge in terms of perception that IT and technology investments are just way too expensive versus being seen as something that is a true strategic asset with a bottom line impact. And by bottom line, we do not mean dollars and cents bottom line necessarily, but we're talking about positive attributes to the healthcare and healthcare delivery of the patients that we deliver our advice to, our medical advice to. So I just want to touch on a couple of points that I danced over kind of briefly. Let's talk a little bit about the knowledge cycle. Let's talk what knowledge is versus information versus data. And I'm going to go through this pretty quickly, and I want to make sure that you understand it, because this is key to what we need to do about how we cycle and move information and move data through the so-called knowledge management cycle, the value of the particular bits of data within an organization. So what is data, for example? We keep mentioning that word, and data is facts, figures. Think of it as a number. Think of it as the number 323, which is kind of abstract. What does 323 mean? What is 323? Well, if somebody tells me that 323 is the batting average of a player who's playing in the World Series this week, then that's giving me information. That's put context around 323. Now I know what that 323 means, and I'm able to do something with it. And once I do something with it, I apply knowledge to do something with that information. So data is just a number, 323. Tell me that it's the batting average of the second baseman who plays for the Nationals in the World Series. I don't know that that's the real number, but now you imbued it with context, and the data is now information, and now I'm going to do something with it. 323 is a good batting average, so I'm going to have that batter bat earlier in my batting order. That's knowledge. Now, there are some people that'll tell you there's actually a fourth level called wisdom, and that is knowledge in use over time. So just looking at the graph, value will increase as you move from data to information to knowledge, and the cost to go from data to information to knowledge will also increase as well. So bearing that in mind, let's look at a very old concept of a closed loop knowledge management cycle, closed loop knowledge-based cycle. The whole idea behind this is once you've identified data and turned it into information or knowledge, you need to put it into a system that is accessible and usable by people in the organization, giving them the ability to read the information, collect, analyze, share the information, maybe adapt the information, make a few changes as they see fit, restructure, then reapply, then put back into the system where it's available again. Now think of this as a medical record, as bringing the information compiled in a medical record and where it would fit in at any point in this cycle, and making that medical record through interoperability and connectability available to all people that need to manage and work with and help the patients in a healthcare organization. So I think this is an important concept to think about. It's somehow lost in the shuffle over the years, and it is absolutely lost in the shuffle if we do not consider IT as an asset within our organization. So let me just throw this question out there. What if your IT department could execute at a more efficient and effective level? What if you and your organization were able to understand the scope of the IT programs and the status and act more intentionally on those initiatives most important to the organizational goals and again to the health and safety of the patients in the organization? And what if you could pinpoint the most strategic areas to focus resources on for the biggest impact and to prioritize it so that you can do it quickly and provide the proverbial biggest bang for the buck? So to answer these very deep, very philosophic questions, I'm going to hand the microphone over to Brett, who will take us through the rest of this presentation. Brett?
Hello again, everyone. So in thinking about everything that Mike just talked about, he spoke in terms of the IT leaders' challenges that they're facing as they deal with their day-to-day work, and he spoke of how IT leaders are being expected to do more than ever before, and at the same time we need to try to utilize the IT assets within the business to help drive further value to the business, and all that needs to be done in an organized way. So there's a big challenge out there. So you can flip to the next slide, Mike. And what we found is we've been doing some research in this area. We went to the state of the CIO from this year, and there were some interesting numbers here that I think are worth sharing around what IT leaders are facing. And so we see here that 47% of IT leaders are spending time on aligning IT initiatives with business goals. And this makes a lot of sense because as we're all seeing in our various businesses, the line drawn between IT and the business is disappearing or evaporating. In most cases, it has completely disappeared, and the business and IT are being merged together in a lot of cases. And so we have leaders that are spending time aligning those IT initiatives all the time with the business goals. That is kind of what we have to do, and that's the way things are working today in IT. Additionally, 42% of the IT leaders are spending time on improving IT operations and system performance. So when we talk in this presentation about the ways in which we recommend that we work, or the approach that we take to work toward improving our IT operations, I think it's going to hit home for a lot of the IT leaders, because many of them are indeed indicating they're spending a lot of time improving IT operations today. They're forced to do that to bring about further efficiencies and improvements. 43% of the leaders who have expanding roles at their companies are adding new responsibilities in operations. So this gets back to the point that I made, that IT leaders are being asked to do more than ever before. With the merger of business and IT together, everyone's role in IT is expanding. And so as you expand, many new responsibilities come into play. And so there's more to do with a small bit of time, or with the same amount of time that you had before. There's a lot more responsibilities to be handled. And so in looking at that that drives you to thinking the only thing I've got that's going to help me get through this is to drive efficiencies and improve the way in which we're doing things today from the way we've done them in the past, because there just isn't enough time to keep up with everything. 40% of the IT leaders indicate increasing operational efficiency is a top business initiative that's driving investments. So this speaks to where the money's at. So there is a lot of investment being done today around operational efficiency in the IT groups. And so IT leaders are finding themselves being pushed to find ways to be more efficient, not just because their role requires it just to keeping up with the amount of time that they have, but also because the business is pushing for that. And actually there's investments being made toward driving those operational efficiencies in a lot of organizations, almost half of them. So with all of this in mind, we want to share a little bit about the approach that we recommend in improving operational excellence and efficiencies. And so what we do and what we recommend that a company follows is to walk through these 4 steps that we're showing here on this slide. An assessment is the best way to start. And the assessment is done in such a way that we're interviewing the key IT leaders, of course, but in addition to that, we're interviewing the key business leaders within the organization that have the most interaction with IT. And by taking what they have to say and finding out what their pain points are, what their struggles are, what's working well, what's not working well in relation to their relationship with IT, this really helps to drive a lot of thinking toward what we could do in this particular organization to help improve efficiencies. Really, where are the most important and most urgent things coming from? And so we assess the overall organization, and we finding that assessment to be very, very valuable information as we find those interviews. Pulling all the data together from those interviews gives you a big picture of a lot of areas that are potential to be improved upon. What we do with that then, and we recommend whether you're doing this yourself or you're asking for our assistance to help you with this, we recommend the prioritization of all of these improvements that are identified. These recommendations that come out of the assessment need to be prioritized, because normally there's so many of them, you can't work on everything at once, and we need to have some type of prioritization scheme. And so we recommend that we prioritize along the lines of the business's urgency, of the fact that how difficult it would be to implement these improvements, and then what value they're going to bring to the organization. And we do a prioritization based on that. Coming out of the prioritization, it's always a good idea to form an IT roadmap. And an IT roadmap is really just a schedule of the events toward moving toward improvement. So it's taking all of those prioritized recommendations and improvements that have been evaluated, assessed, and recommended, and taking those and building them into a schedule that shows which of these are going to be done in parallel, which of these can be done only in serial. So you have to complete this one as a prerequisite to get to the next one. What order would we recommend doing this in based on the amount of value that it's going to drive and the amount of time it's going to take to implement? And we build all that into a roadmap so that you and the organization are all looking at the same roadmap. The business, the IT leaders are looking at a roadmap that they can all kind of collaborate on to decide whether it's really the right way to go. And then you have something to work from, and everybody's working off the same sheet of music. The collaboration is on here because that impacts all 3 of the previous steps that we take. We want to ensure that none of this is being done in a vacuum by the IT group, or none of this is being done in a vacuum by an organization such as ours that steps in to help with this type of an effort, but we are collaborating. So we're all the time working with the business and with the IT leadership to make sure that there's an agreement among everyone on what it is that we're going to be improving on, what the prioritization is of that, and what the schedule looks like. We don't want to do it with just one group in mind, but everyone needs to agree so that we come up with something that everybody is behind and supporting as we move forward. Okay, Mike. In terms of the assessment effort that we do undertake or recommend to be undertaken, we do in fact recommend, as we talked about, the IT stakeholders need to be involved. So the IT leader, whether that be a CIO, a lot of hospitals won't have a CIO, but they might have an IT director or somebody who's in charge of IT. And then the individual staff that are direct reports to that leader, as well as the service desk support, because service desk is a client-facing function or a business-facing function that needs to be taken into account whenever we look at improvements. And then the important part of this also is that, as we mentioned earlier, the organizational stakeholders are brought in. So it's very important that we get functional units from the business to all come in with their input onto what could be improved and what the pain points are. You want to involve groups such as finance, patient care, HR, overall operations, and the list could go on. But these are always important to make sure that we're getting the input from all of these leaders and all of these groups. And then what you do during the assessment process, we would recommend that you look at the IT groups, all of the IT groups. So don't skip over anything, but we would recommend you look into how the service desk is performing. You look at the infrastructure and the application teams, the ERP team, if you have one, database, enterprise architecture, certainly security, because of the importance of security in any hospital. And so we recommend that you don't overlook any of these groups, but we actually do an assessment that takes into account the operations within each and every one of those parts of your IT organization. And secondly, we a lot of times find ourselves focusing on the following functions within IT, where improvements are generally found to be, what I want to say, low-hanging fruit. These are areas that really normally turn over some type of recommendations that could improve the operations. And those areas are things like the IT governance, of course, which oversees everything that happens within IT. Resource planning, onboarding and offboarding. Onboarding and offboarding sometimes is just seen as a simple task, but in reality, there's a lot riding on that from a security standpoint. There's a lot riding on that in terms of cost. And so bringing efficiencies to that can drive a lot of improvements. Capacity and demand management, we find, are very, very important. Whether you have that in place today in the IT organization or not, even if you have it in place, it usually can be improved upon so that there's a clear understanding that when a request comes into the IT group, there's an understanding that that demand, where it fits in with everything else that the IT group's being asked to do, and what capacity they have, so that it's not just a black hole, but it's seen as, I understand what my request is going to do once it gets to IT and how long it's going to take for it to get completed. And that's very, very important. Change management, prioritization among, as we've talked about, the prioritization of each of the requests from all the different organizations. There needs to be a process to ensure that the prioritization is done correctly so that the business gets the most value from the things that are being worked on first by the IT organization. Reporting, communication, these are all areas that we find things to improve upon. We can switch over to the next slide. This is merely an example of how we do the, let's say, prioritization of all of these recommendations. So you may have 50 or 60 recommendations that come out of an assessment. And what we recommend is that you break down each and every one of those and assign to them a rating of how urgent that particular recommendation or improvement is. So it can be, urgent, it can be high, it can be medium, it can be low. And we rank that based on, how urgent it is to the business at this particular time. We then also take the ranking of how difficult it is to implement this improvement. And some of these are going to be extremely hard to implement. Others are going to be easy. We just ranked it based on where we think that's going to fall. And the importance of that is a lot of times there's a lot of value in finding some low-hanging fruit that you can work on right away that are not going to take a lot of effort, but are going to bring a great deal of value and are urgent to the organization. And so you want to make sure we can identify those and make sure those are worked on first. The third component of this graph is the size of the bubble, and the size of the bubble indicates the amount of value to the business that would be driven by that particular recommendation. And so once all that is plotted on a chart like this, we draw a green circle around the improvements that are recommended in the bottom left-hand corner. And the reason why we look at that first is because that's where the priorities in terms of urgency are very high. So these are extremely urgent items to be worked on, and also they're of the lower level of difficulty. So they're either in the easy or the medium category. And so it makes a lot of sense to tackle the ones in the green circle first. And you can also see the size of the bubble indicating that many of these are ones that are going to bring a lot of value to the business. And so it really makes sense to tackle those first. The second thing we recommend is that you just expand the circle, and that's what the purple circle represents, a little bit larger, and then that starts to take into account some of the items that are of a little less on the priority scale, but not a lot, but especially those that are a little bit more difficult to implement. And so you work your way up to a lot of the bubbles that you see in that top left-hand quadrant they fall within this next circle. And many of those also have high value by the size of the bubble. And these are indicated as things that are a little bit more difficult to complete. They might take a little more time, but they're still extremely urgent. And so we start to work on those next. And then it's not to say that we forget about everything that falls outside. It's just that we move into those bubbles that fall outside the two circles as a little further down the road. These also are somewhat urgent, although you can see the urgency starting to wane, and the difficulty of these can be very difficult and extreme at times, but they bring a lot of value. So we will work on them. We just won't do them immediately, or they won't be the first things we work on. So that's what we try to do, and we try to help you prioritize what you want to do with all of these various recommendations that come out of the assessment. Okay. The last thing that we develop and deliver to the business, and the last thing that we recommend anybody that's doing this to do, is the roadmap. The roadmap is so important. It takes you from what your current state is, once you've identified as part of the assessment what your current state is, and you identify based on the input that you're getting from the business as to where everyone would like the IT business to be. That's your future state. And the way in which you get from the current to the future is your roadmap. That is your schedule of identified improvements. Which ones are we going to work on initially? Which are kind of medium term, and which are long term? And for an individual business, long term can mean a few months. Long term could mean quite a few months. It depends on what the organization looks like, and depends on the type of recommendations that come out. But the initial focus recommendations should begin immediately, and those can be worked in parallel with some of the medium-term ones. And we just lay that out on a very organized roadmap schedule that's going to show people within your organization exactly what you're working on and when, and everyone can start to have a vision as to what's going to happen over the next several months. The next slide here, Mike, if you want to switch over there, is just talking about our status of information. So throughout the whole process, anyone that's doing these recommendations needs to make sure that they're communicating with all of the organization to let them know what the status is of how this is progressing. And so since you've identified the prioritization and you've grouped things into phases or groups, like in this case, we had groups A through F recommended the priority order to complete different initiatives. We identified, which of the improvements have actually been completed so far, which are in progress, and then how many have not been started. And sometimes a very important point here is the on hold improvements, because there's always, for good reason, some of the improvements need to be put on hold because of a freeze to the software, because of the lack of resources being available at a particular time of the year, and you can't really complete that particular item at this time. There's many different limitations that would cause you to put something on hold, and that's fine as long as the whole organization agrees that that particular improvement is being put on hold. Then everyone's aware. And so what we try to do is ensure that there's a good status report that's showing all of the people, process, and technology related improvements, and they're broken out and showing, just how the progress is moving. so that everybody can see that things are happening and that they should be able to start to see improvements that they can recognize as they work with the IT group. And then lastly, we just wanted to, yeah, the next one there, Mike. Yeah, we just want to talk a little bit about, what areas are impacted. So, the common organizational benefits that come through this improving of operational efficiency and excellence are really going to impact, your patient care coordination and patient experiences. We find that by improving IT organization, we also improve patient safety and outcomes. We drive productivity across the staff. We reduce operating expense. And this is important because obviously there's the cost associated with implementing improvements, but that cost is almost always lower than what it's going to do in terms of driving a reduction in operational expense over time. As things are done more efficiently, less time is being spent by a large number of people in getting the same amount of work done. Additionally, you'll see privacy and security for patients will be impacted by many of these improvements. Improved financial performance. Decrease in processing time is a big one because by driving these efficiencies within our processes, you generally will find that processing time throughout the organization is reduced as IT starts to make these efficiency improvements. There's definitely an accelerated time to the completion of initiatives and increased innovation as we're now stepping back out of our daily jobs and taking time to actually look at how we can innovate within the IT group to better serve the business across the hospital. Just then to recap, so we've talked a lot about how to drive these operational improvements, and what we recommend is that you go through a process where you assess, prioritize, develop a full roadmap, and collaborate throughout the entire time. And that's where you start to turn those what if questions that Mike brought up into reality. And the way in which we can help, well, we can come in and we're more than happy to provide a low cost initial consultation on site or over the phone to just kind of discuss what your current challenges and pain points are. And as we begin to hear what those are, we can then begin to identify, the types of initiatives that we've identified for other organizations and give you a little perspective and context around what we may want to do for your organization, or whether it even makes sense to take it to the next step. And if so, if there's determined that there is value, then we can do a very low cost and really no risk involved, because all you're going to get out of this is some interviews, and you're going to get a large number of recommendations and of improving various areas. You don't have to commit to it, but it's going to be a great set of recommendations to help you get down the right path. And we can do that at a very low cost by coming in and doing a high impact assessment that delivers the prioritized sets of improvements and delivers to you the IT roadmap that can be used. And then we find organizations that are able to implement that themselves, and other organizations that want some help in implementing that roadmap and driving it forward because of everybody's busyness in their day-to-day jobs. And so we can step in and help with that as well. These are just a couple of ways that we can help. Rather than just dump all this information on you, we're there to walk you through it and help you get there. The next slide here just indicates a little bit of a client success example. This was an organization that we worked with, a large organization that was able to utilize what they learned from us in terms of recommendations and improvements and drive a number of results. And you can see all the different results that were achieved in a very short period of time. Many reductions in terms of security risks and time spent by the IT department resolving issues, eliminating a lot of non-priority work. There was a lot of good that came out of this, and this slide you can look at later, but it just has a quote from our IT director at this business that indicated how pleased they were with what we were able to produce in a short period of time.
Okay, so thanks, Brett. And now is a chance for you to interact with us. I think, Nick, you had mentioned, at least texted to me, that there were a few questions that you saw coming in. and perhaps you can walk us through them.
Yeah, no problem at all, Mike. And as a reminder to the audience, if you'd like to ask an additional question, you can use the chat feature of your GoToWebinar control panel on the right-hand side. Right now, Brett and Mike, we have two questions that have come in. The first one is, in your experience, what are some of the challenges you've seen in trying to do this on your own?
Okay, well, certainly one of the challenges is everybody is so busy in their day-to-day work that we see that almost every organization has a extremely lean IT department. There aren't very many groups that have a sizable IT organization that has no problem keeping up with everything that's going on. It's just that's not the reality today. And so because of that, the challenge is how can a group that is fully maxed out on their time to get their day-to-day work done, how can they focus on innovation and improvement? And that's a very difficult challenge. And one of the ways to do that is to bring in a third party to help you begin to step back and spend a little time with these interviews, spend a little time with the organization, asking the right questions, and then formulating those questions into recommended improvements. And so we find that one of the biggest challenges really is just that. It's just time, and we try to help by coming in and assisting, and that overcomes that limitation. And you do still need some of your people's time. You don't want to do this in a vacuum, like I mentioned earlier. But less time would be spent by pulling your whole organization out to do these interviews than it would be if somebody were to step in and help you.
And I also think, if I may, Brett, that you come down to a whole litany of issues around subjectivity versus objectivity. When all of the perspectives are taken and managed and even audited in some cases internally, the old saying is you can't see the forest for the trees, and I think it's very apropos here. You know your organization and you know your culture so well that any of your observations, in fact, may be a little bit tainted by the fact that you know your organization so well, and it may be tainted negatively as well as tainted positively. So having an independent eye to take a look at things, to bring that perspective in, really helps to master a capability of taking things that are very subjective and to be very objective about it. Now, once you get to objectivity, then you can start to deploy so-called industry best practices. The problem I've always had with best practices is that the best practice research that goes on are usually done by people with a very slanted point of view. So the best practices never end up being the best practice. They end up saying, well, it's the best practice in your organization, it just won't work in my organization. However, if an independent is coming in and they're being very objective about the point of view, they'll look at a best practice and they won't think about the differences, but they'll think, how can it be applied and adapted into the organization first and foremost. And in my mind, and certainly the time commitment area that Brett talked about is equally as important.
Mike and Brett, thank you. We do have another question that came in. It said, we are a small hospital with limited budget and bandwidth. How should we go back to finance and operations to justify going down this path? Any recommendations?
Yes, based on our experience, I mean, that's a very good question. Budget and bandwidth, time and money. Where are we going to get that if it's limited, and how can we justify spending money when we're already at that limited budget and bandwidth? Well, it's a great question, but what drives this is the recommendations that we find at most organizations that we work with are going to outperform what the cost of doing that, both in terms of money and time, by the benefits that come out of it. So what we find is by driving the efficiencies, you find that your IT organization is going to be able to do a lot more with the same size organization that you currently have because of the efficiencies that have been driven. So you're going to see that there's an increased bandwidth that comes out of an implementation of the variety of improvements that are generally recommended coming out of one of these assessments. And by driving that bandwidth down, you have people that have more time to spend on some of the higher value type activities. And so you'll even find just as I mentioned in that earlier slide, some of the results that we achieved at one of our clients, this is pretty common across all of our clients, that they find that they have more time available than they had before. And also some of the efficiency that we drive will in fact save money. And so that does free up some funding to at least pay for the assessment that was done. And certainly you'll see ongoing improvement to the cost of generally the IT supporting the organization. Mike, did you have anything to add to that?
Yeah. You know, I think this is also a case where some real out of the box thinking can come into play. I mean, we've had discussions with several healthcare organizations where, you know, true to the title of this particular webinar, IT is looking at IT as an asset. They're looking at the data and the information as a potential asset. Once they get their arms around the data, once they get their arms around the information and even the knowledge that flows from it, they're able to anonymize it properly and to figure out ways to monetize these particular bits of information along the way. They've got access to such great information, and the information, as you saw on the chart about halfway through this presentation, as the quality of the information increases, the value of the information, and this is certainly true from a monetization perspective. Think of the access to the information that you're going to have in your healthcare organization, and think of the value to, say, a pharmaceutical company. Think of the value to companies that track information and track hospital data and information along the way. And there are some companies that are looking at ways of taking the information, cleaning it up, anonymizing it, and then monetizing it and selling it to various bits and pieces in the organization, outside of the organization. So it's something to consider. It is, in its truest, most literal perspective, looking at not only the information technology as an asset, but the waters that flow through the veins of this information technology, the data, information, and knowledge is something that could be a potential asset to the organization as well. Nick, anything else come through?
No, that's it for now. Before we wrap up, Mike and Brett, do you have any parting thoughts for the audience?
Brett?
I would just say, you know, we're more than happy to speak with any of you if you reach out about how you would go about doing this, whether you want to tackle it on your own or want some help in doing this. We're more than happy to give you advice and counsel on that based on our experience. So I'm more than happy to do that if you reach out.
Yeah, and I would also, first of all, I'd like to thank everybody for taking the time out of your busy days to dial into this webinar, to listen to what we had to say. Hopefully you found some, if not a lot of it, very relevant as it pertains to your organization. This is a particularly important topic. Certainly important to our way of seeing and looking at the importance of information as it plays within the healthcare industry and your healthcare organizations. You know, as a patient, I am particularly overwhelmed by the amount of my data that gets out there into the ether and circulates amongst my healthcare providers and medical centers and pharmacies and everywhere else that has my medical information. And the more I am able to provide information into the system, whether it's through a smartwatch or some other form of data gathering tool, the more that this information needs to be credentialized and privatized, and ultimately categorized, taxonomized, and hopefully put into good use by wherever it's going. And you know, I'm just one person. You know, you've got millions and millions and millions of people throughout the country, throughout the world that have their medical information digitized in some way, shape, or form. So I think this is an extremely important area and subject, and I would ask you to take a real reflective look at how it's handled in your organization and look at ways to manage it much more effectively, much more efficiently, because it will be beneficial not only for your organization, but to the patients that so need your organizations. So with that, Nick, I think Brett and I are ready to wrap up. I don't know if you have any closing parting words for us.
Yeah, this concludes our webinar for today. Like Mike said, we do want to thank everyone for their time today. And also, Mike and Brett, thanks to you for taking time out to present on this important topic. We will be sending out a link for the recording afterwards. We do hope that you found the content valuable, and we do hope that you have a great afternoon. Thanks, everybody. Have a great day.